Are we live? All right. Hey, everybody, thanks for joining. We are live here at City Hall, and I am going to take questions about not only the coronavirus, but really anything going on. As we wait for people to join us, I just wanted to first give a little bit of an update. I think that a few things we have working right now, and I'll probably have to refer to this again as more people jump on with us. First of all, I want to recognize the good work that people are doing in our city. It seems that the stay-home order is actually being respected, and people are lowering that curve that we wanted to do. Remember, the goal is to make sure that by staying in and keeping a safe distance for people, that we are making less people sick at what we consider the peak, which means that we will actually have people be able to, if they need medical care, to be able to get a bed over at the hospital. Last thing we want is what's happening in New York, where there's a run on the medical facilities. So the way that we flatten that curve is to practice safe distance from other people, at least 6 feet. I think the CDC has actually recommended that people wear a mask now, and also, going out only when needed. Going out to the grocery store hopefully once a week, once every 2 weeks, and then just getting back when you're done. Also want to talk about some of really the bright spots in our community and what people are doing to kind of come together at this time and make sure that in Wichita we're facing this head on and not just focusing on the virus part, but also the other parts, such as the local economy. I wanted to highlight some of the work that Kinsey Borland did. She was a student over at Wichita State whose small business was closed because of the coronavirus, and what she did is took that time to create a website called ictresponse.com, and made this website a wealth of information about the coronavirus, but more so also to list the small businesses in our community. And I think it was this weekend I was chatting with her. She was able to update even more businesses to that website, ictresponse.com. And what we're trying to do now is kind of celebrate Xmas or Christmas in April. So what we're doing is we want to make it so people, if you get that stimulus check or if you're in a position where you're able to still spend some money on goods and services, if you could go to ictresponse.com and look at the list of small local businesses, buy gift certificates, buy merchandise, buy stuff that you might gift later in December for the holiday season, or stuff that you might utilize this summer. Right now, a lot of those businesses aren't able to operate because we don't have people out in the streets utilizing those businesses. So a way that we can keep them afloat and support our neighbors is to utilize ictresponse.com and buy gift certificates and support our local economy. Any questions yet?
Not yet.
All right. So I will say that I was on a call earlier today with the hospital community and with Pete Meissner over at the county commission, who is the chair of the county commission. As you guys know, the county commission is really the ones in charge of handling a health crisis, unlike in other cities where the mayor might be in charge. That power actually falls to the county commission, who serve as the board of health. On that call, the hospital community has asked that we continue social distancing for at least the next 3 weeks. I know it's getting tougher. There are people who have been doing this for about 3 weeks now, and it's tougher as the weather is getting nicer, but we are in a pretty decent spot compared to other communities because of your efforts, because of the efforts that the general public are taking to utilize social distancing and to take this epidemic seriously, or this pandemic seriously. And the hospital community wanted us to thank you for that, and also continue for what's probably going to be at least 3 more weeks. If we do this right on the front end, we can actually save lives. And remember, that's what this is about. It's not about just worrying if ourselves get sick and how we have to deal with that. It's really worrying about passing this on unknowingly to someone else who might fall into that vulnerable population category. And that's what we want to avoid. So even if you're someone who feels confident that you could get this virus and be okay. We want to make sure that you're not passing along that virus while you're out and about, because it is contagious before you get symptoms. And some of us won't even have symptoms. So after speaking to the medical community today, we want to pass that along, or I know that Pete's got it on his side, but I'll just do the same. Pass along that the social distancing is working. We are looking good compared to a lot of other communities, and we want to keep that up. It's not going to be easy, but if we do it right, we'll save lives. So just be forward thinking, just about 3 more weeks is what the hospital wants us to do now before they reevaluate. And the more we do today in a short term, the more likely it is that we will return to our normal lives quicker. So with that, I also want to thank the first responders and those who are working at the hospital, and also the medical community, nurses, doctors. Really, I think that there's obviously, you don't have to hear it from me. We all know that they're the heroes here. They're the ones in the front lines working to protect our community. Our police officers and our firefighters are also right in there, where we can't tell you enough how much we thank you. And we want to protect you in a medical community with our first responders by staying in, by trying to flatten that curve and utilizing social distancing and respecting the stay-home order, because the more we do that, the more likely it is that the medical community and first responders can do their job. We're putting themselves at risk, at the smallest amount of risk, which is really what we want. So do we have any questions yet, Megan?
Not yet, but maybe share some of the ways in which you and the City Council are taking this pandemic seriously.
Well, so some of the things that the City Council is doing, and really here at City Hall is practically closed outside visitors at this point. We're operating on a skeleton crew because, we still need the functions of local government. Like if your water line breaks, you need to be able to call someone to come out there and fix it. Or, if you need a police officer at your house for whatever reason, a police officer should be here on call to be able to dispatch. So we do have the core functions of local government operating, but with City Council, we are utilizing technology to have people who can stay self-isolated or respectful of the stay-home orders and still participate, utilizing I don't know if it was Zoom that we used or a Microsoft product. Anyways, we are able to try to maintain social distancing and keep people safe while still using technology, so we can have open discussions, face to face. Moving forward, we will have our meetings where we'll have the overflow, right? That's what we did last time, where when the governor's order was 50 people or less, we had someone count how many people were going into the room, and then we had an overflow room. Now I think it's 10 people or less is the order, and we are on a council. We'll be sitting 6 feet apart. We're utilizing the tables up front. We have less staff who will be on hand. We want to keep it under 10 people in a room to abide by the order. And then we'll be utilizing, I think, the overflow room for other people who will be in attendance as well. And to maintain transparency, we will be running these on our Channel 7, I believe, and live streaming as well.
On YouTube as well.
On YouTube as well, okay. So we want to make sure that people can still watch what we're doing. Transparency is something that won't suffer during this time, and either will the business of the people in which you elected us to do.
Is the Wichita Police Department writing any tickets for the violation of the public health order?
All right, so first question is the Wichita Police Department writing any tickets for the violations of the stay-in order? So at this point, I don't believe they are. I haven't been updated by the chief yet, but my understanding is that enforcement through education is actually working. We had, I think it was last week, a business who was very defiant and wanted to continue as normal, practices, and the chief actually sent someone out there to talk with them about how they're endangering lives by cramming a bunch of people in a tight space. And this business actually decided to do the right thing. At first was defiant, and then once they got that information, they decided to abide by the order. In Wichita, we're finding out that most good people, once you give them the information, they do the right thing. A lot of times people are out and they might believe they're staying within the, within the guidelines by maybe out in a group, but they're outside, so they think that's okay when they're not doing the 6 feet. There are people who I think are in good faith, still out and about, and usually when you give them the education that they need, that's more than enough. However, I'll follow up on this because I did find out that the police chief and also the district attorney are looking into situations on what if things escalate. What if we find out that there are businesses or other groups of people who just are going to be in defiant of this order? What is that next step? So that's something that's being discussed currently, and once I figure out the details on that, I'll be more than happy to share them with the public.
Brian wants to know what your day-to-day activities look like as mayor.
My day-to-day activities as mayor, so I don't know what the normal day-to-day activities are as mayor. I can tell you what mine are. When I got in here, it was the spirit crisis, and now it's the pandemic crisis. I'm thinking next week I start my 3rd month, and I wouldn't be surprised if we're fighting robots from outer space. If I came in here and Megan came to my office and said, "Oh, hey, the aliens landed. We got to fight off the robots," I wouldn't be shocked at all. My day-to-day activity is I do show up at City Hall, and one of the reasons for that is I believe personally that if you're going to have employees show up at City Hall, then one of the people who are in charge needs to be there. I just think that it's not good when you have businesses that are still operating who, the boss might be at home and safe, but the employees are out there. I kind of feel the same way where myself or the manager should be here if we're asking employees to be here. However, we are keeping safe distancing. We are utilizing all the best precautions, and the good thing about City Hall is, I think we've been ahead of the curve when it comes to making sure that people, I'm fighting this virus. I can get my temperature checked every time I walk through the door. Everything is sanitized. We are going, I think, above and beyond at City Hall to keep our employees safe. Other than that, I'm on a bunch of conference calls, usually with the medical community, usually with our friends over at the county commission, and then also with my own networks over at Harvard, where I'm able to get in on some of the teleconferences about best practices for dealing with the coronavirus, as well as the Association of Mayors and some of the other organizations that I belong to, trying to get ahead of what has been working in other communities that have faced this, because some communities got hit a lot sooner than we did. So I'm trying to figure out what the best practices and policies were that worked for them and apply them here in Wichita. And also, as I mentioned, the county commission really takes the front end on dealing with a health crisis. So part of my job is to figure out how do I complement that. So if they are utilizing the stay-in policy, then my job is, okay, well, if everyone's doing stay-in, how do I make it so our small businesses are still, able to, to earn some money? And that's, working with Kinsey to create the website, ictresponse.com, putting our small businesses on there so that people like you can go and buy gift certificates and promoting that. Or working with our partners at United Way to make sure that when people are abiding by the stay-in order, they have access to, some of the services and information that they might need.
This one might be a little bit early. I'm not sure that we know these numbers yet or are able to predict them, but Scott wants to know what the impact on sales tax revenues might be.
So the impact on sales tax revenues might be, that's a good question, Scott. We've actually had a pretty huge estimate on what the hit's going to be. The one thing we do know is it's going to be a sufficient hit. It's not going to be pretty for Wichita. And also as a city, when it comes to our budget, it's not just the sales tax, but also the food trucks, the license that they utilize. Are we going to charge people to get their pet license renewed? We're going to have a policy discussion on Tuesday where we have our first summit for the budget and talk about some of these where, we are going to get hit when it comes to sales tax and revenue, just on a tax side, but also what's the responsible thing moving forward? Are we going to waive fees for people who might be late on the water bills or on their parking tickets, knowing that this is such an economically stressful time for the community, what can we do in our part? So we're actually going to take a financial hit from a multitude of different streams, but it is going to be something that's ongoing. I think that right now the estimates are very wide range, but they are in the millions. And I don't think it's responsible for me to just give a number at this point because they were pretty much give or take times 3. But it's going to be a lot, and we're going to have to tighten our belts and make sure that we're doing a responsible thing, not just in running government by having the services that you depend on there and offered at a high level, but also trying to trim anywhere we can to make sure that we have some extra money left over to be responsible to people out there who, when it comes to stuff that they might be purchasing or paying off for the city.
Jessica wants to know if we are still on lockdown. I think she means the stay-at-home order.
We are, Jessica. Please stay home. So, and the stay-home order, there's a few things with that I want to just touch on. So it's definitely not house arrest or lockdown. It's really, you can go walk your dog. You can play outside. We are asking, or the order is, when you go to work, practice, if you have to go to work, practice best precautions. Right now it's wear a mask, stay 6 feet away from people, wash your hands constantly, utilize hand sanitizer, and then go right home. It's, try to go to the supermarket maybe once a week if you used to go 3 times a week. It's really getting out less, being around people less. And I do just want to say that we are very fortunate to have some of the supermarkets in our area that are putting down spacers so people know what 6 feet away from someone else is, who are counting the amount of people who can go in so that we don't have large crowds. We do have, they're doing their part, and I think we got to do our part by going out less. So we are, and we're going to ask people to really focus on that for at least the next 3 weeks. The next 3 weeks until our medical community can reevaluate, and then until the medical advisors over at the state level so they can reevaluate as well. But we really want to hammer this home, for the next few weeks, because if we do it right, then we can perform, I think, as a community much better than what other communities have done when faced with the same pandemic.
Perfect. There's a question on whether transit and construction are essential services and why those are still running.
So one of the interesting things with the essential service order, keep in mind this came from the governor, and there is no blueprint, okay? We haven't seen a pandemic like this since, I think, 1920 with the Spanish flu, maybe. So there is no blueprint. So what we're seeing that our state enforced and other states have is really a standard best practices with some exceptions that are trying to balance public safety with continuing certain services in certain services. So really, I wasn't obviously in a room when they made this document. I don't think the governor was either. I think that they got it passed down from policymakers, and it's pretty standardized throughout the country. But there are some stuff on there that I think people question on, is this really is this really essential versus that? And the policy people in a room gave, I think, a really good first stab at this policy. Obviously, this list needs to be revised. We should be going back and figuring out what are the unintended consequences that come with any form of policy. So I think that there might be some revisions if they go and continue this order. But moving forward, we want to give them I think, a little bit of grace. I get, well, why are liquor stores open when liquor stores are, how come they're essential? And, the medical answer is, well, if you have people who have a certain amount of, alcohol in their routine, and they go without that, they'll actually utilize hospital beds. So, there are legitimate reasons for some of these. I don't pretend to know all of them, but moving forward, because there is no blueprint, because this is like a once in 100-year situation, I give the governor a little bit of grace with this document, and I know that her team is looking towards revisions and taking kind of the what's working, what's not working from other communities who have put this same structure in place so it can be improved.
There's some questions about unemployment and some concerns about, it's been difficult for a lot of people to get through. What's your advice for people facing those issues right now?
Okay, so because of last month's super crisis, I was able to really build relationships with people over in the unemployment office over at the Department of Labor. Secretary Delia Garcia is a friend of mine and has been for years. She is the Secretary for the Department of Labor, and I've reached out to her a few times with this. And I'll tell you, they are slammed. Okay, just imagine we have more people than our history right now reporting to the Department of Labor sign up for unemployment benefits right now. So, and we've had about 10 years of really strict, tightened state budgets. So just keep in mind that this is unprecedented. They are not at the capacity that they need to be dealing with this type of situation. I think everyone gets that, but also, there's that kind of back of the mind where like, so what? Like, yeah, this is a problem, and I get that they're having difficulties processing all these people, but I still need to be processed. So the advice that I got from the secretary is if you are someone who has access to the internet, please utilize the website. Don't call. The phone number is actually supposed to be reserved for people who don't have access to the website or for people who are not native English speakers. So if you speak another language, then you should be utilizing the telephone. The website is supposed to, I guess they just did some updates to the features. You can reset your PIN easier. They are maneuvering the website to make it more user-friendly. But the last thing they're asking people to do is to tie up the phone lines if there's someone who have access to the web. Again, this process is not perfect. This is a crisis that we're in, and this is unprecedented. They were operating off a budget that was given to them last year, before anything with coronavirus was even on the radar. So they are moving, I think, as much as they can. You have to be highly trained to process this paperwork, so it's not like they can just bring people in to start doing this. So her advice was to utilize the website. If you're someone who's comfortable with the internet, don't be one of those people who put your stuff on the internet and you're just waiting for a response, so you call them 500 times. That actually, is tying up the phone line. That's adding to the problem. So definitely the first thing to do is to go online, to fill out your claim there, and then to hopefully be patient. Unless you have more questions and more issues, then you can call. But they've been swamped. So it's not negligence on their part. It's the fact that we're at a historical crisis level, and they just the Department of Labor is doing their best with the people that they have, but it's just not providing the services that they have in the past because of this historical event.
We'll take one more question. I've seen a couple questions pop up about private businesses. Should they be supplying personal protective equipment for their workers?
So I've gotten this question a few times where there are some businesses that are still open, that they're on the list, and they're essential, and how should they proceed moving forward? Really, as I mentioned, this is unprecedented, and we want to make sure that people are safe. So I kind of refer to this order as not just the stay home order, but the stay safe order, where hopefully responsible business owners have masks and have gloves, and are making sure that customers are 6 feet away from employees, making sure that they're doing what they need to do to keep people safe. If they're not, then it really becomes beholden to the employer if they choose to show up to work, to bring their own mask, wear gloves if you need to make sure that you are maintaining that 6 feet distance. We all are in this together, and we have to work together to make this environment as safe as possible. So I see a lot, and I get a lot of feedback on the internet, and I see a lot on Facebook about this or that. If you have a relationship with your employer, maybe talking to them about ways that they could implement the 6-foot rule, or make sure that there's hand sanitizer out there. We are really in this together. So I think that part of it's a personal responsibility. Part of it is, of course, on the employer as well. Together we can hopefully stop the spread of this virus. All right, so that's about it. Just again, if you just joined me, I want to just give a shout out to our small businesses that right now are experiencing hardship. One of the things we're asking people to do is to celebrate Christmas in April. I read an article in the Eagle, and I think it was the Eagle, and one of the news outlets, and people were putting out Christmas lights a few weeks ago just to show to show some positive spirit. We saw that Friends University lit up their tower. It's something that they usually only do over the holidays. Let's take that theme and let's apply it to helping our small businesses who right now are struggling by buying gift certificates and merchandise and services online. If you go to ictresponse.com, it was a website designed by Kinsey Borland. I just want to make sure I got her last name right. Kinsey is a young woman from Wichita State University who owned a business, had to shut the business down because of the coronavirus, and took that time to design this really great website. Go there and you will see some of your favorite shops and restaurants and different businesses throughout Wichita linked up there. You can go on their website and hopefully purchase something for yourself to use this summer, or maybe get a head start on your December holiday shopping. The point is, there are people out there whose businesses are not in operation. We want to keep them afloat, as much as we can, because they're what make Wichita unique. So please check out the website. If you are a small business also and you're not on ictresponse.com, please, there's a link there to submit your information. Please make sure you submit your information, and Kinsley, I think, would be more than happy to add you to the list. Other than that, I want to thank everyone for maintaining social distancing. Again, I was on the phone with the hospital community today, and they think that we are on the right path when it comes to social distancing, and really want to hammer home that the next 3 weeks is going to be critical. So we don't want to take our foot off the gas. Please continue your social distancing. We're doing a good job, and we're going to get through this stronger as a community, because we're facing this head on as a community. So with that, thank you all.